this is a short case, so it's an 8-minute session. You need to read the following scenario. It takes place in a single session. You need to take a history from the patient. There's no examination required. You need to manage the significant elements of the case, discuss confidential issues, discuss your conclusions and propose management.
No worries.
Okay, so Sam, you've got a 36-year-old mother who presents with a 6-week infant. She needs you to fill out some paperwork from Centrelink. You will have access to the Australian Immunisation Handbook. Now, Johnny, are you going to be my patient, or am I being the patient?
I think I'll I'll be the examiner.
Okay, very good.
Yep.
Okay.
Great. Okay.
Yep. So you're walking into the room.
Awesome. Okay. Hello. Hi. My name's Sunny. I'm the doctor. How can I help you today?
I just need some paperwork filled in for Centrelink. They gave me, I don't want to immunise my child, and they gave me this piece of paper to have filled in to say that, yep, it's okay that I don't want to have my child immunised.
Right. Okay. No worries. So I'll be happy to help you today. Before I do, I just hoping to get a quick idea of why you're not keen to get your child immunised.
Well, they all contain aluminium and mercury, and I really don't want to put that into my child. I've done a lot of research on it online, and also talking to people like my naturopath. And I'll do the natural immunisations, but just with the amount of aluminium and mercury in the immunisations, I'm really not keen on putting that into my child.
No worries. I can see how if you've sort of read those things, it might be quite scary. You only want to do what's best for your child. Maybe if we just take a quick step back, can I just ask you a few questions about Bub? Well, what's Bub's name to start with?
Rose.
Sorry, what's your baby's name?
Rose, R-O-S-E.
Ah, no worries. So it's a baby boy or girl?
Baby girl.
Great. All right. Look, is Rose generally fitting well? Does she have any other health problems?
No. We had a lovely home birth with a midwife. Normal birth. She came out really, really well. She's been doing fantastically ever since, and she's fully breastfed.
Fantastic. Good. All right then. And any sort of developmental concerns with her? You know, with her. I mean, she's only 6 weeks old, but do you have any concerns about her development at all?
No, she's very alert and looking around at everything, and she's starting to smile, and she's absolutely beautiful.
Fantastic. And were there any problems with the pregnancy or anything like that?
Nothing at all. Never felt better.
All right. And is there any family history of any problems that you're concerned about that Rose might be sort of prone to?
No, nothing at all.
Great. So it sounds like Rose is pretty fit and well at the moment. And
she is.
Great. And has she had any immunisations at all to this point? At this point?
No. She didn't have the Hep B because I asked for it, but she didn't have it. Because I know that they get the 3 Hep Bs later on, and so what's the point of getting the Hep B at birth when they're just going to get the 3 later on? So, and I also knew that it was just to get them on the immunisation register, and I wasn't going to immunise her anyway.
No worries. Okay. Look, I think in relation to the concerns you have about immunisation, I guess as a doctor, I'm in the position where I see lots and lots of people who get their children immunised. And the vast majority of them, I'm sort of talking more than 95% of them, have no problems whatsoever. The concerns you talk about... It's just the
long-term issues that we really don't know much about. Like, how do we know that aluminium is not going to have an impact? And like, if you have a look at the product data, it'll actually say aluminium in the product information.
Yeah. Look, that's a valid concern, I guess. I mean, immunisation has been around for a long time, and the research data that we have to this point has shown that the levels of mercury and aluminium in the vaccinations is actually so low that the risk of any long-term damage is probably pretty low. I take your point though that you know it's really hard to tell what might happen sort of 50 years down the line.
Right, and you're obviously responsible for.
Look, it can be a really hard decision. I guess immunisation is probably one of the most successful sort of public health interventions that has come about in the, you know, in as long as sort of medicines have been around, and the adverse problems because of it are really quite small. It's quite a complex area, and I wouldn't mind sort of
the chance of her getting anything is so small.
Yeah, look, you're right. The chance is really small, and that's mainly because most people get their kids immunised. So the chance of picking it up from anyone else, just because everyone else is immunised and they're not going to get those illnesses, is so low. That's something we call herd immunity. And if more and more people don't immunise themselves, there'll be more of those diseases floating around and more chance of unimmunised people catching those diseases.
But why should I harm my child? Like,
yeah. Look, I can see that you really care about your child and you only want to do what's best. I think in terms of the paperwork, I don't think that's an issue. I will happily fill that out for you. But I think it's really important that we sort of make a time for you to come back and maybe so we can touch base and we can talk a little bit more. Maybe after you've read some of the information that I give out to you, answering some common questions about immunisations.
What sort of information would you give me?
Yeah, so there are handouts that we can get from that the government, that health departments put out. Just going through some really common questions that people have about immunisations, like what they contain, how they actually work, what the potential sort of side effects are. Maybe if you didn't mind, if you have a bit of a read of those, and then you maybe come back in a couple of days.
Yeah, I'm happy to have a read for that.
Yeah, and we might make a bit of a longer appointment, and we'll discuss some more of your questions. And maybe we can check over Rose a little bit as well, and just go through her her childhood handbook, make sure she's up to date with other things besides immunisations, all of her other health checks, and those sorts of things.
If I know that there's in the US they do different sort of immunisation schedules, and so say if there's 2 immunisations that they usually get at 2, 4 and 6 months. They've said, look, let's split them up. So let's do one at 2 months, one at 3, then 4 and 5, and then 6 and 7 months. Would you be open to doing something like that?
Look, I tend to follow the immunisation schedule, which is put out by the department. If you wanted to alter that, I'd probably get some advice from maybe an infectious diseases specialist, just to make sure that we're not going to, under-immunise your child, because we've obviously got that schedule for a reason, and we don't want to alter it to the detriment of the
So that's time.
The roads.
Yeah, cool. Awesome. Well done. Now, this is one of my pet things, because I actually have a special interest in paediatrics. And this is something that's usually so poorly done by doctors. You did remarkably well. I wanted to come back. I wanted to read the information. I wanted to engage. You started to leave me when you wouldn't put the immunisations, but then you said you'd have to look into it. So I'll tell you, that out of all of the patients who I get come in who don't want immunisation, only 2 out of my patients still don't immunise. So what my key things that I do is go through the Australian Immunisation Handbook has a little flip chart at either the first cover or the back cover, and it actually goes through the risk of complications with immunisation and the risk of complications from the disease. Fantastic. So we go through that. Then I go through which immunisations are key. I'm going, look, Hib's really key because it causes meningitis. Pneumococcal is really key because it causes meningitis. And then I actually engage them in the process, and I say, look, okay, if it is a fairly well-to-do family, I go, well, look, we can probably cut out rotavirus. You know, if the child gets vomiting and diarrhea, you just have to tell me that you're going to bring her in ASAP. And I say, look, there is an increased risk of hospitalisation because of the rotavirus if you don't immunise. But most of the reason we immunise against rotavirus is for lower socioeconomic people because they don't know the warning signs of dehydration in these children's diet. I split my immunisation. I've got an immunology background on that time. If you're splitting immunisation, you still have to fill out the Medicare paperwork for conscientious objection. Because if you split the immunisation, Centrelink still don't like it, and you'll get rid of their payments. So I fill out the conscientious objection form, split my immunisations. That means they're still getting their Centrelink payments, and I'm still keeping the patient and the mother happy. So you can work around this so well to just work in and get them involved and engage them. And it's remarkable how many people you can convert to immunising just by doing that. You did fantastic.